What is the urinary diagnostic marker for carcinoid syndrome? That means what substance found in the urine, and that is the diagnostic for the carcinoid syndrome. Here the options are beta hCG, histamine, chromogranin A, 5-hydroxyindole acetic acid, and 5-hydroxytryptamine. So what is found in case of carcinoid syndrome in case of the urine? So here, first of all, in very short, let's see the carcinoid syndrome. The carcinoid syndrome, it secretes serotonin. So carcinoid syndrome, it occurs from the carcinoid tumor, and the carcinoid tumor, it secretes the serotonin. And the carcinoid syndrome, it is developed from the neuroendocrine cells. It can occur in the intestine, but extraintestine also occurs, such as in the bronchi. And the hormonal symptom mainly occurs when they spread outside the bowel. That means the carcinoid syndrome, the syndrome only develop when this occurs outside the bowel wall. Here we are watching some important clinical feature. First of all, let's see, this is the flushing of the face, palpitation, pulmonary valve stenosis, and tricuspid regurgitation, asthma, and severe diarrhea. So they are the clinical feature of the carcinoid syndrome, and the carcinoid syndrome only develop when the hormone release from the gland and finally release from the tumor, and it is metabolized by the liver. Now see the investigation. This part is very important. First of all, let's see when in the case of the urine and also in the blood. So what we can find in urine and what substances present in the blood. So in the urine, here we can see this is the 5-hydroxyindole acetic acid, or 5 here, it present in the urine. On the other hand, in the blood, it is present chromogranin A. So chromogranin A present in the blood, but in the urine there is 5-hydroxyindole acetic acid present, and it is diagnostic for the carcinoid syndrome. And other investigation can be done, and they are the somatostatin receptor scintigraphy and CT scan. And what is the treatment of the carcinoid syndrome? Actually, most of the tumor requires surgery. So surgical treatment is the main treatment or definitive treatment for the carcinoid syndrome, but octreotide may be used to reduce the symptoms, such as the diarrhea and other symptoms. They are usually reduced by the carcinoid syndrome. So, and a rule is important for the carcinoid syndrome. First of all, it is the third rule. That means 1/3 multiple, 1/3 small bowel, 1/3 metastasize, and 1/3 second tumor. And the carcinoid syndrome, it secretes serotonin, and the carcinoid syndrome will only occur in the presence of liver metastasis. The hormone released from the primary lesion will typically be metabolized in the liver. So it is, I think it is clear that the urinary diagnostic marker for the carcinoid syndrome, it is the 5-hydroxyindole acetic acid. It is the 5-hydroxyindole acetic acid. It is the diagnostic marker in the urine for the carcinoid syndrome. And other options such as the chromogranin A, usually present in blood in case of the carcinoid syndrome. Thank you.